Hello, everyone. Thanks and welcome to our June 2020 Waste Management session, a collaborative of the ASLM and CDC, in which we tackle this important issue of waste management. Today, we have a very important topic from the Global Fund, where they are going to introduce to us their technical brief on sustainable healthcare waste management. We have talked a lot about provision of quality health services. We've talked a lot around scaling up services for HIV, for TB, for malaria, even for non-communicable diseases, whilst we are getting the benefits of overall well-being for this. Unfortunately, we have a corresponding increase in the amount of waste that we produce as a result of testing. So our colleagues at the Global Fund really take this seriously and encourage that all applicants for global funding address environmental concerns into their applications in order to make sure that we have sustainable healthcare management practices. So they've come up with a technical brief where they have designed it in such a way that it guides all those participants who are preparing these applications to make sure that these interventions are really friendly to the environment. To tackle this, we have a lineup of 3 presenters in the name of Dan Jacobs, Dr. Anne Hoodrich, and Francesca Fest. I'll let my colleague David Bresler introduce the speakers for today. Over to you, David.
Well, good morning, good afternoon, and good evening to everybody. I think that this is going to be a fantastic presentation. Thank you, Anafi. Dan has 16 years of waste and resource management experience working across waste collection and disposal functions, having spent 12 years working for local authorities in the UK and alongside private companies. He has extensive operational knowledge of waste treatment processes and is experienced in the development and implementation of waste strategies and policy at local and international scale. In complex waste management contracts that include public and private partnership agreements and in due diligence projects. He is a chartered waste manager and leads Mott MacDonald's waste and resource management team. Dr. Anne Woolridge is Chief Operating Officer of ISSL, a technical consultancy, and has a wealth of research and practical experience in healthcare waste management and waste treatment processes at all levels. She is a practicing dangerous goods safety advisor and a waste consultant, as well as advising on waste strategy and policy. She is the chair of the International Solid Waste Association Healthcare Waste Working Group and a member of the UK National Committee. She is also the vice chair of the Chartered Institution of Wastes Management Healthcare Waste Special Interest Group. She has an MS in environmental management with a focus on healthcare wastes and a PhD in developing sustainable management for healthcare waste. She is a chartered waste manager, a fellow of the Chartered Institution of Wastes Management, fellow of the Royal Society of Medicine, and recognized by ISWA as an international waste manager. And last but certainly not least, Francesca First is a senior specialist resilient and sustainable health systems at the Global Fund to fight AIDS, TB, and malaria. With that, I'm going to turn it over to them to hear this wonderful presentation. Thank you.
Okay, can I just check that you can all see the presentation slides?
Yes, perfect. Thank you. Go ahead, Dan.
Very good. I think Francisca was going to just start off with the first few slides, so I'll allow Francisca to go through those.
Francisca, are you there? Okay, you can unmute yourself. Okay, let me try. All right.
Thank you. I think now, yes, perfect. I didn't have permission to unmute myself. Thank you very much, Anafi and David, for that introduction. Maybe we go already to the next slide, which gives you an overview of what we will, and definitely Dan and Anne will take you through. Having said that, the core mission of the Global Fund is to end HIV, TB, and malaria as epidemics. But as a dynamic partnership, we are adapting to the changing world context, including the challenges we see in arising environmental impacts from our operation. That's why we have taken it up for this funding cycle to issue a technical brief that is very much focused on setting up sustainable healthcare waste management systems that can be supported in the upcoming or the current funding cycle. Let me say a few things about the Global Fund. I think most of you probably are well acquainted with how it works. It's a partnership of government, civil society, and the private sector, and people affected by the diseases, funded in 2002. And the Global Fund mobilizes and invests approximately 4 billion every year to support programs to fight HIV, TB, and malaria. Together with its partners, the Global Fund has proved that the global commitment in these 3 diseases can achieve remarkable success. I think alone in 2019, 18.9 million people have been put on antiretroviral therapy. 5.3 million people have been treated for HIV, and 131 million bed nets have been distributed. Having said that, this is a large amount of funding is spent on health products and commodities, and obviously this inevitably generates also a substantial amount of healthcare waste. I hand over here back to Daniel, who will take you through, together with Anne, through the rest of the presentation.
Okay, thank you very much, Francisca. So I want to start off by looking at the opportunity that is presented to the Global Fund in helping to support waste management. And firstly, by looking at this side, which identifies those parts of the world that during the previous funding cycle, the Global Fund helped to provide investment to. So we can see here that a significant proportion of disbursement was allocated to the sub-Saharan Africa region, and then a smaller proportion to the Asia and Pacific region. And this is important because when we come on to look at the next slide, we can see there is a very strong correlation between the parts of the world where there is deemed to be a lack in even basic waste management services based on the joint WHO and UNICEF report that was published in 2019, and those parts of the world where the Global Fund typically invests in health products and programs. So clearly there's a big opportunity for the Global Fund to help make a difference to improvements in waste management services in these parts of the world. In addition to the in-country support that the Global Fund can help to mobilise, given the role that it plays in helping to procure or directly sourcing products and supplies, it's important to look at where interventions could be best used throughout the supply chain. So we carried out a very high level red, amber, green assessment of the points in the supply chain where we felt that interventions would be most critical, and we determined that it was during manufacturing, during dispensation and use, and through maintenance, and at the point of end of life, that waste management interventions would be most critical. And that was primarily on the basis that at these points in the supply chain, we would expect larger volumes and quantities of wastes to be generated, and for the types of waste to be generated to typically be more hazardous in nature, and therefore requiring more stringent controls in place to prevent potential harm to the environment and to human health. So, in order to address some of these issues, the Global Fund is now encouraging applicants to address environmental concerns and to incorporate sustainability and particularly in respect of healthcare waste management practices into their operations. And this wording is taken directly out of the technical brief itself. And to help implement that mission statement in effect, it has this year, as part of its new funding cycle, launched a new intervention package which seeks to avoid, reduce and manage healthcare waste and support improvements in those areas. So this is a direct extract from the intervention package, and I'm not going to read it out in full, but you can see here some of the examples of interventions that would be supported by the Global Fund in respect of waste management. And I think what I want to get across as the key takeaway from the intervention package is that it is not just about providing funding or investment for small-scale incinerator projects for local healthcare facility provision. It's much more about developing the system. It's much more about taking a holistic approach towards waste management development. So you can see here there are examples of interventions that would be supported around green and sustainable procurement of health products, around the development of policy frameworks at large scale, developing operational plans and guidance, helping to implement practices that are environmentally friendly and safe for workers, and also helping to support engagement programs that raise awareness at community level around how to manage waste in a sustainable way. So the key point here is that it's not just about infrastructure, it's not just about equipment, it is about the bigger picture. So to help implement the new waste management intervention package, the Global Fund, with our support, launched a new technical brief in February of this year. So the purpose of the technical brief is to introduce the concept of sustainable healthcare waste management system development, cover some of the technical aspects of what we would expect good waste management to look like, and importantly to raise the profile of some of the key principles that we would expect to underpin good waste management, and also raise the importance of encouraging grant applicants to assess which parts of their system most require the gaps to be filled and improvements to be made. In terms of what the technical brief itself looks like, this slide just presents a broad structure of it. So we firstly really make the case for the importance of sustainable healthcare waste management, and then introduce some of those key principles that I'll talk through in a couple of slides' time. Importantly, the technical brief also really describes what we would expect grant applicants to do when they are applying for and making the case for healthcare waste intervention funding. And again, I'll come on to talk about some of those key aspects shortly. We also then wrap the technical brief up by pointing towards some of the best practices in healthcare waste management more generally, and then we annex some of the key approaches to management of healthcare waste as an appendix to the technical brief. And Anne will be talking later about some of the specific approaches that we talk about in respect of the management of lab wastes later on. So in terms of the rationale for sustainable healthcare waste management, within the technical brief, we introduce a key definition of healthcare waste, and we've taken this directly from the World Health Organization Blue Book, otherwise called the Safe Management of Wastes from Healthcare Activities. And we refer quite regularly within the technical brief to the Blue Book. We note that it was produced in 2014, but it is still considered to ultimately be the best reference material and the most relevant in respect of healthcare waste management practices in low-income and developing countries. And the importance and purpose of putting the definition into the technical brief is so that it's understood that healthcare waste is not just the nasty, hazardous, difficult waste to handle that comes out of healthcare facilities and clinical practices. It's also waste that is otherwise non-hazardous but still needs to be managed, such as general waste, packaging waste, or offensive waste, which actually makes up a significant proportion, broadly 85% of waste that would be generated in healthcare facilities. We also, within the technical brief, begin to describe the types of wastes that we would expect to be generated from products and programs that the Global Fund invests in. And without going into any of them in any particular detail now, the key waste types that we would expect to be generated are broadly infectious wastes, packaging, electrical wastes, chemical wastes, pharmaceuticals from drugs, and to a lesser extent, offensive waste. So it's important that these types of waste are considered appropriately within the technical brief and appropriately within the intervention measures that grant applicants are seeking to introduce. In terms of the key principles that we include within the brief, we want to make sure that these are fully embedded in the system development approach that we are seeking to encourage grant applicants to take. So we want to ensure that a precautionary approach is taken whereby interventions happen at the earliest stage possible to avoid potential environmental damage further down the line. We want to encourage grant applicants to treat and dispose of waste as close to the point of production as possible to minimise transport implications. We want grant applicants to think about the roles that producers can play in helping to manage the impacts of waste, and also trying to make them slightly more accountable for potential environmental damage or burden that might be caused if the wastes aren't managed properly. We also cover concepts around environmental sustainability and the importance of reducing hazardous substances during product manufacture, and critically around the principle of duty of care, where we are asking waste producers to make sure that they have an awareness and understanding of what happens to the waste at the point that they hand it over to somebody else or a different entity, to make sure that that waste is disposed of in as compliant manner as possible. We also introduced the concept of the waste management hierarchy, which is hopefully familiar, but principally prioritises the prevention and minimisation of waste, perhaps through considering how much product is actually needed and making sure that the amount that is being ordered is actually appropriate. And then moving on to topics such as reuse and recycling, where we seek to try to make the most out of those products and the most out of those materials before they require treatment or disposal. And then finally, we seek to encourage as much value to be recovered from those materials before they then require final treatment and disposal. So we make a big point within the technical brief of selling the importance of compliance with the waste hierarchy in waste systems development. In terms of what we would be asking grant applicants to do when putting forward their case for waste management intervention support, we raise the profile of compliance with key international conventions. I don't propose to go through them in any level of detail now, but what we want grant applicants to do is to make sure that where they are proposing an intervention or a waste management measure, that it is compliant with these conventions and does not contravene them in any way. We also, within the technical brief, talk about the types of healthcare waste legislation that we would expect to be in place at national level, and we set out very broadly what we would expect to be included within that legislation if it doesn't already exist. So we talk about there needing to be legislation to cover a waste duty of care process. We talk about there being a need to identify what hazardous waste is and how it should be registered and consigned throughout the waste process. We also talk about the need for a permitting and licensing regime to be enshrined in law, and also for the need for there to be laws that reflect appropriate medicine and infection control measures and help to ensure that workers within the waste management sphere are adequately protected when they are managing healthcare wastes. We also require there to be legislation in place that sets out how dangerous goods should be transported, given that particularly most of the hazardous substances will have some kind of hazard relating to them during the transport process. And we also would expect there to be legislation in place that defines how healthcare waste should be classified, segregated, and appropriately treated. We then raised the importance of stakeholder engagement, and we identify the types of stakeholders that we would expect to be involved in sustainable healthcare waste management system development. So we talk about the types that would be included in both the public and private sectors, but we also raised the importance of involving the informal sector in waste management system development, because typically in low-income countries where there is a less developed waste management system, most of the recycling and recovery activities are performed by the informal sector. So integrating those activities into a formal system would be fundamental in developing improvements moving forward. We also, and I mentioned at the start about making sure this wasn't just about providing funding for incinerators and small scale equipment or infrastructure. And this is a big sell point in the technical brief, is making sure that there are plans in place at national level. So we described what a good national waste strategy plan should look like, to the extent where we would expect it to include policies that say what it is that needs to be done, targets that says when it needs to be done by and how successfully it should be done, performance indicators that would monitor how it would be measured on a month-to-month or annual basis, and also the identification of procedures and guidelines that will steer how it would actually be implemented. We refer again to the importance of stakeholder engagement and also to identifying where the money would come from to implement such policies and measures, and how much would ultimately be needed. Importantly, we set an expectation for grant applicants to assess the existing level of capacity within their system and to determine the strengths and weaknesses that it has to manage waste moving forward. So to do that, we have also developed a national capacity planning tool. The purpose of the planning tool is to enable grant applicants to do just that. So we are asking them to self-assess the existing level of capacity within their healthcare waste management system across 4 categories, those being institutional capacity, describing organisational arrangements, i.e. who it is that does what within the system, what level of managerial capacity there may be within the system, so is there an adequate level of competency, and is there an adequate level of training within the system, and then finally what waste infrastructure might exist, so whether that is equipment or waste treatment facilities itself. In doing so, they would be answering 74 specific questions within the tool, and the responses to those questions would lead to a grading and scoring system where we provide an automatically generated grade ranging from very weak to very strong for each category, and then an overall score of somewhere between 0 and 100%. And obviously scores towards the lower end of that range are deemed to be weaker, and those towards the upper end of the range are deemed to be stronger. We visualize this within a spidergram, and this just helps to identify the parts in the system that might require more investment and might require more attention in respect of the interventions that grant applicants are seeking to implement in accordance with the Global Fund framework. So this would be an appropriate point for me to hand over to Anne to talk about risk profiling. So I'll go on mute, but I'll still steer through the slides, Anne.
Thank you very much. Thank you for inviting me to speak. One of the things I'm not going to go through the fine detail. I'm going to talk about how we did this. So with respect to the technical brief, we had to look at a range of products that were supplied through the Global Fund, funded through the Global Fund. And this varied from lab reagents, which we're going to focus on today, through equipment, a wide range of items that Dan sort of alluded to. So we risk profiled in a very, very objective way. We didn't make any assumptions. We didn't assume that there was waste management in place. We took each product based on its own merits and classified it, looked at segregation, how it would be collected, transport, treatment recovery options at a wide range of facility levels, looked at the impacts on the environment, and looked at human health. So when we take a product, we're looking at right from the point of its waste generation right through to any impacts it could have and how it could potentially be treated. So we looked at a range of databases. As I say, we made no assumptions. So it's all completely based on objective resources. We looked at the Janus database, we looked at safety data sheets, We looked at whether items would be potentially out into the community, whether they were going to be managed in a laboratory environment, whether there were issues potentially with supply chain. So we took all these factors into account and came up with a grading scale. And as we can see, of all the products that were assessed from the Global Fund, only 6% of them were assessed as high risk. And I think when you look at the list that's in front of you, you'll be able to see why some of these were high risk. Some of the pharmaceuticals are showing up as higher risk because they go out into the community. They are delivered, they're given to people to take away, to take. So at that point, we have very little control over storage, very little control over collection. So that's why they would be showing as a higher risk than maybe something that was managed, delivered from a healthcare facility. But what's really interesting is 59% of those products we assessed came out as very low, or of no risk at all. And I say these were objectively assessed. So that a lot of the stuff that's supplied by the Global Fund has the benefits of those products very much outweigh any potential disbenefits of them, particularly when it comes to waste management. Let me go on to the next screen. Where we risk profiled the products themselves, we didn't have access to the facilities that would be available in each country. One of the things that's really important is to identify what facilities you do have, particularly with disposing of viral load wastes and testing wastes. What facilities are there? And there's some really good tools that can be used, supplied by World Health Organization, supplied by Water Sanitation and Health, to see what facilities you've got and to determine what you've got and where you need to be going to. The technical brief that Dan's referred to has shown that if you use that, you can start to identify whether you've got good policy and planning, but perhaps poor infrastructure. So as a combination of the products themselves and the capacity planning for your country, it's going to be quite easy to build on the global baseline report that already exists. So there is a baseline report from WHO, but this is about building from that, together with the information supplied through the risk profiling, the information in the technical brief. And this is really about a springboard to go forward, and the information supplied by us or by the Global Fund research will give you some ideas as to which areas you need to focus on. Can we go to the next slide, please? So focusing on lab reagents, we look at it through its entire life cycle. So we look at it before it gets there. Don't take fundamental stuff, don't take big cardboard boxes into your laboratory areas if they're going to get contaminated. Let's look at ways we can start to segregate things. Let's look at the implementation of the waste hierarchy. Again, looking at the risks and waste management implications during use, classification, and then again looking at what we've got left with, how we get rid of it. We know, for instance, guanidinium thiocyanate is a chemical that's used frequently in virology and for in testing cartridges. But how's it got rid of? So one of the things we need to look at is, how do you get rid of it? Where does it go? Because we've taken the risk profile of those products, you can look at the relative risk of that and say, well, actually, this is a much more important thing that I deal with than maybe something that's lowered down that risk. So it's about prioritizing as well. Where you have a limited resource, prioritize and look at the things that are going to cause the least environmental and human damage. Start to see how you can collect them. Start to see how they can be stored, ready for disposal. Maybe it's a centralized disposal. So it's about looking at those waste management options. Can we go to the next one, please? So as I was just starting to say, classify it. Within your national and regional legislation, there should be something that indicates how you classify your waste. Is it infectious? Does it have chemical? Is it just general waste? Is it something that can be recycled? Once you've identified the properties of the wastes, then you can make sure it goes for appropriate treatment or appropriate collection routes. We realise that the informal sector is very, very important in the management of a lot of wastes. So it's also about keeping those people safe. If you know that waste has got an infectious property, then you're going to treat it differently than if you know it's got a chemical property. If it's got chemical infection, then we need to start looking at some proper disposal methods for those. Okay. Handling and storage. Do you have protocols in your laboratory areas, in your healthcare facilities for hand washing? Where do you use gloves? Are gloves always the right thing to use? There are, how do we manage liquid waste? Liquid waste in some ways is more hazardous, but in terms of environmental and human damage, than the solid waste, because we can collect that and we can do things with it. Liquid waste is more likely to escape. Storage. Rainwater can be a real problem, or fire. As well as storage, we also have to look at the fact that if you've got solid waste that's susceptible to fire, fire damage is something that we lose quite a lot of stock through supply chain. So how is the waste stored? Is that waste going to be a risk? How do we store liquid waste? Because we really, really need to stop that escaping to the environment. That's all right, I can't see the right other side of that slide. So we really need to make sure that our waste is handled, classified. There are international ways of classification. A lot of the classification, I saw a question pop up at the bottom. Classification is based on a lot of the European classification models, and they are readily available to classify. A lot of them also follow the international conventions. So as I say, we've got to classify it, handle it, store it correctly. We would then need to transport it correctly. So we need to ensure we follow regular guidelines. If you are in a country that has signed up to the ADR, to the Agreement for the Carriage of Dangerous Goods by Road, there are really good guidelines there. There tends to be international legislation that you follow. There may be local interpretation, but on the whole, the international legislation is that you should follow, and there is readily available advice on that. So we've classified it, we've handled it correctly, we've stored it correctly, we've now transported it correctly. So the last thing we have to do is make sure that it goes to somewhere that can be could appropriately dispose of it. So our ideal scenario, which we realise it isn't always possible, is going to be a dual chamber incineration with flue gas treatment, and really making sure that those chemicals are destroyed with no negative environmental damage. As we work down, we may look at some autoclaves. But again, some chemicals can't be autoclaved for practical reasons, for the fact that maybe there's a water phase, maybe it's only suitable for infectious waste. So we've got to look carefully at the treatments that are available. Incineration without flue gas treatment or encapsulation is not best practice, but we do realise that it sometimes has to happen. But the last thing we need is uncontrolled dumping, uncontrolled burning, uncontrolled anything. So the more control we can get, specifically with some of those laboratory wastes that have those really hazardous chemicals that have environmental and human damage, those are the ones that we really need to make sure that we can capture to ensure that we correctly treat and manage those. So what the technical brief has done and what the research that's been carried out on these classifications and risk profiling will enable you to look at the products that you are using to try to make sure you can find an appropriate method of classification, handling, storage, treatment and disposal. I'm now going to pass back to Francisca, because I think she's got some more resources that she'd like to talk about.
Thank you, Anne. Yeah, the presentation very much focused on the content of the technical brief and not so much on how you can actually access the funding mechanism itself. We have included in the presentation the links to the application and funding cycle material. The Global Fund has just started a new funding cycle right now, and many countries have already submitted their proposals and some are still working on it. From what I can see, many have included waste management intervention in their funding proposals. So the uptake has really resulted in an uptake of these interventions. And yeah, go and visit the links and connect with the relevant people in the country if you would like to include waste management in the funding request. It's certainly encouraged from our side. Next slide. There's also a new mechanism in place for the COVID response. It's 500 million that is responsible, dedicated to the countries. 10% of their normal allocation can be applied for to support the response and mitigating the effect of COVID. In there, of course, waste management has a place. Obviously, this is these are shorter and applications that are only valid for 1 year, so it's not as much of an input into a sustainable system as such, but yeah, you can still include waste management intervention and assets in these funding requests, and also from what I can see, many countries are asking support in that area. I think that was from my side as well. Thank you very much. Very much looking forward to your specific questions via the chat, and handing over to Anafi.
Thank you, Dan and Anne, for the wonderful presentation. Very informative indeed. So we've got to the stage where we take the questions and we get some responses from the presenters. Please enter your questions or comments into the chat box and we'll take them from there. They are still coming. Just slightly deviating from the usual, I just want to pick up on Chinedu. He has been raising his hand for quite a while. Chinedu, I think you are now unmuted. Just briefly, go ahead with your question.
All right. I want to thank the presenters for a wonderful presentation. I'm listening from Nigeria. And my question is on how effectively can we deal with liquid waste we generate in the laboratories. Thank you so much.
So Chinedu is worried about liquid waste, any subject that we talk over and over again. Let me give the chance to the presenters to tackle this.
I think I'll pick that one up then. I think we realistically, we need to start capturing it. So where I know historically a lot of it has been discarded to watercourses, we need to start capturing those liquid wastes, but only those. We don't want to dilute them. So there's two options: we either dilute them to a non-hazardous level, but then that also has its own hazards associated. But the best thing we can do is to capture them, store them, and then transport them properly and get them treated, maybe at a cement kiln, maybe at a dual chamber incinerator. That is going to be the best for those liquid wastes, because we know that some of them contain some pretty environmentally damaging and can damage humans as well. Were there any specific chemicals you were thinking of?
I've already muted.
Okay, don't worry. But yes, so the hazardous chemicals, we should be capturing the liquid wastes and managing them in an environmentally sustainable way.
All right. Thank you. I think most of the liquid waste that we've been talking around has been mostly around GTC.
Yeah. And we know that that has massive environmental benefits because obviously of the nature of what it does.
All right. So I'll pick another question, and this one came by email from Betin Huede from Colombia. And he or she says, I think was anticipating that you would talk about incineration. Do you know what is the waste incineration capacity in most African healthcare facilities? What have you found from your work?
Over to you as well, Dan, but we haven't actually, the capacity planning will be up to each country to do themselves. We haven't capacity planned. We've showed people how to do it for themselves. Dan, would you like to expand on that?
Yeah, I mean, I think it comes down to whether the question is meant in respect of the tonnage or volumetric capacity of the incinerators themselves, or whether you mean the capacity of the country to be able to treat waste and incinerate waste compliantly. I think ultimately the answer is it's incredibly highly variable. Part of the project that we've worked on with the Global Fund was not necessarily to do an analysis of what the incineration capability was of each country that it funds, but certainly as part of the national capacity planning tool, we would be expecting countries to carry out some form of assessment around how much capacity is required and where that capacity is located, and to identify gaps, because it might be that there actually is sufficient tonnage capacity within the country to treat all of the infectious and hazardous waste that might arise from healthcare facilities, but it might be that it's located in the wrong place. And one of the things that we are trying to emphasize with the technical brief is to try to consider whether there is or whether it is more feasible to develop more regional hubs for healthcare waste treatment rather than the localized approach of procuring small-scale incinerators that might only be capable of treating waste from one particular healthcare facility. So obviously to do that, that's going to require a more national and coordinated approach to be in place. So the whole emphasis behind the technical brief and the whole emphasis behind the capacity planning tool is to try to get grant applicants, particularly where they're at relatively community or local based level, to talk on a more coordinated basis with stakeholders at a more national level to try to make sure that some of these interventions are larger scale. I know that I'm deviating slightly away from the question, but the point of what we're talking about today is really to try to foster that mentality so that it's less small scale and more big scale thinking.
Thank you, Dan, for the response, indeed. Moving on with the questions, you talked about national classification somewhere. And the question from Pascal here is, if this is not available, can you advise on what international norms that should be used?
As I said, there's some European classification guidance. We would use, there's also classification advised through the dangerous goods regulations. So there are tools that are available to tell you what thresholds you need to meet as to whether they fall as a hazardous substance, which needs to be managed in one way, or whether they fall in as non-hazardous. So there are calculations that can be made using guidance from certainly Europe, and I'm sure there's also guidance in the United States as to what constitutes hazardous and what doesn't, and then the appropriate disposal methods for those.
Okay, thank you. So from the tool that you presented, are these tools, I'm using the same word twice, but are they incorporated? Is it something that we can be able to access and then share with the participants right now?
Yeah, so within the presentation slides, we've got links to the technical brief and links to the capacity tool. So those are directly available on the Global Fund website. So when you click on the link, it will take you straight to those tools. So yeah, you can see those. If participants wish to access them and have any follow-up questions on them, then obviously we're happy to explore those. Subsequently. But just to clarify in terms of the question on classification, we don't go into it in specific detail within the technical brief. The reason being that there is so much discrepancy at international level and so much inconsistency around what classification schemes there are in place from one country to another. But we simply point to what the World Health Organization Blue Book says as what we would expect to be the most simplest system in place, which is a four basic categories. So again, that is linked to within the technical brief, and we would encourage participants to refer to the technical brief and then click on the relevant hyperlinks within the technical brief that take you to the World Health Organization guidance.
Thank you once again. This question I know has been asked earlier on, but it speaks to, I think, one of the major challenges that we are facing in most of the labs across the continent and possibly beyond. The issue of liquid chemicals and how these bottles should be disposed. And this question is coming from Margaret Maturi, and she's asking, how best do we do this segregation?
How you segregate it will depend on what you've got in your laboratory, what facilities you've got to do that, how you can capture that. We know that some of the analyzers, for instance, are just plumbed to drain. They just disappear, it just disappears magically. So it is about making sure you've got mechanisms to capture it. Again, disposal will depend on what options again are available. There are some, like we say, we've discussed a range of technologies, and there are other technologies as well. There's smaller scale gasification pyrolysis units. There are some other alternative treatment mechanisms that can be used to work with a range of wastes. So I think it has to be a waste management solution that fits the majority of what you're generating. There may be the odd waste you have to get rid of and centralize that disposal. But certainly it isn't just limited to a large batch scale autoclave and a large dual chamber incinerator anymore. There are technologies coming on board all the time, and people are developing technologies for smaller scale. So it may be that you centralize within an area of the country. And again, that's something that we look at in the capacity planning tool to see what technologies are available to you. Because it's no point in saying, oh, here, have a massive autoclave and you've got no, you don't have enough water, you can't get steam pressure, and you haven't got three-phase electricity. You've got to make sure that the solutions that are in place are relevant to the situations that you're in.
Thank you. And I think I want to take another question. You may find that most of the questions are really going back to liquid waste. This is because initially this platform started really on the basis of trying to fight the challenge that we had with liquid waste from paraload and EID testing. But with time, we evolved, and then we started looking at healthcare waste as a really health systems issue. And I'm glad when I see a question from Moses Madege, who at first says, very good presentation indeed. So apart from incineration, is there any other best way to deal with contaminated blood bags in blood transfusion centers? Yes.
Blood transfusion is quite an interesting one, because I wouldn't have said that was incineration waste. I would say that was perfectly suitable for a non-incineration technology, something that decontaminates, maybe autoclave, there's some microwave systems out there as well. But blood transfusion, we should be looking at non-infectious wastes anyway, because hopefully that waste will have been screened before being transfused. So we don't necessarily have to give that any decontamination level at all. I'm not saying you just dump it, but certainly we have very little hazard to remove for waste for blood transfusion. So I wouldn't recommend that's incineration waste. I think that's actually over-treatment.
Okay, interesting. I wish we had, I hope there are blood transfusion specialists here. Would be glad to hear their responses as well, because naturally when somebody sees blood, they are always thinking of infectivity. But I think I follow you as well.
Yeah, I think yes, there are at some points blood would be classed as an infectious body fluid because we don't know, or somebody's got an infection. If you're testing for HIV and they test positive, you're going to say, I've got a bloodborne virus. And hepatitis we know is also a problem. But I think where you're looking at the transfusion blood, then we have, you screen those people. So I think we have to sort of do a scale of risk, and not everything is infectious. And from a waste management perspective, waste only becomes infectious when you know it is. From an infection control perspective, and I'm sure there's loads of infection control people on the call, you assume everybody's infectious till you know they're not. But from a waste management perspective, you assume that it's not infectious until you know that it is. And that's quite interesting. That's quite an interesting step change in the way you think when you see blood.
Thank you. Thank you very much, Ian, for also clarifying that waste management and as well as infection prevention as well.
I work with both teams a lot
Yes.
of the time.
I see a couple of questions also requesting for slides. As usual, these will be available to all of you who registered for these sessions and beyond. And there's just a comment really to thank the presenters on this presentation from Teferi, nice as well. There's Marion Poges, I hope I pronounced that correctly. Marion says, would waste to energy solutions like gasification be considered for this call?
You want me to go, Dan, or do you?
Can you start on the context of whether it is suitable or not for chemical waste, and I'll then cover a more broader point on it, if that's okay.
Yeah, okay, it can be. One of the problems with gasification and pyrolysis process is that you have to have your waste really quite small. So you have to shred it and you have to blend it. So it's about the blending process. There will be some processes that it's suitable for, but it's going to be all about the blend. It's going to be about getting it in to that gasification pyrolysis unit and getting all the right conditions, the parametric conditions of it to work. It's not particularly proven technology for clinical wastes anyway, just because of the variation. You really need a really nice homogeneous stream. You need to know what you're getting. You need to get like relatively good particle size, calorific value. So clinical waste is generally too variable for it to be very successful. But I'll stop now because I could do this for another hour. I'll pass to Dan for that one.
Yeah, no, actually, I'm not going to say too much different to Anne, but I think certainly gasification and pyrolysis technologies, particularly where we're seeking to scale up the waste management application and scale up the infrastructure, are not proven, and they're not actually technologies that my consultancy advocates or supports. So we have worked on a number of projects, not necessarily clinical waste applications, but more broader solid waste applications where the technology has failed. As Anne says, it requires a fairly small scale, regular, homogeneous flow, and if that is not the case, then there are difficulties in the performance of such technology. So we would, we've made the case quite strongly throughout the work that we've been doing with the Global Fund that if incineration is required, it should be standard high temperature dual chamber incineration, and if that can be scaled up, then that's going to likely to be the most cost efficient way of doing it, and that is then the point at which you might then seek to get private sector involvement in the development and operation of such facilities.
Yeah, I've been working for the last 15 years with people, and it just comes around on a cycle. Like, can we use it? Yeah, we can. It doesn't work. Let's take it out. Let's move it. There are some applications that it does work very, very well for, but it is about that continuity of having a really nice stream of a fixed particle size. So if you've got one, you may be able to put up to, say, 0.5 or 1% of your waste through, but it realistically is going to be a tiny, tiny part of the other feedstock for that process.
Okay. Thank you for that insight, indeed, and it will help actually in making that final decision whether that could be used. And this one is from Timmy Donko, and I think this goes to Francisca. And I'm glad this is picking up from the presentation that Francisca came on this platform last year, December, almost 6 months ago, presenting the Global Fund opportunities in waste management. And we're also glad that there's this brief. Timmy says, what are the implications of this brief for labs at the point of purchasing supplies or shipping biological samples to collaborating partners overseas? What are the implications of the brief? Francesca?
Yes, thank you. Well, the implications of the brief is that very actively applicants are encouraged to include waste management interventions into their funding requests. Obviously, it's always a competing interest. There is a country dialogue that has to take place where you have to place and make a rational case for these interventions. That's why we developed this rather comprehensive technical brief to guide and help applicants to make that case and to get these interventions in. But that is mainly the main purpose. Obviously, we also see most of the waste that is generated or funded through Global Fund in a way is on the lab side. So last year in December, as you said, Anafi, I came with my colleague Eileen Burke to present on what are the actual opportunities to integrate these intervention into a funding requests. Did I understand the question correctly? Because there was a later part in terms of partners, which I didn't capture entirely.
Yes, I think you captured it quite well. I had moved away from the question, but I think you did. I mean, what is the implication in terms of those that are actually going to be using this particularly? I know this could be affecting at national level, but it will then trickle down to the facilities. So I think
exactly. Yeah.
All right. There is another question. It's a little bit technical that I saw through the chat, which was talking around disposal of acids, sulfuric acid, hydrochloric acid, that have been stored in the lab for several years, but not in use. And this is interesting. It's quite common in many of the labs.
Yeah.
How do you do this? Yeah.
Legacy chemicals. First of all, I think that you need to be absolutely sure that what they are what they say they are. And I think that they need to go through a formal chemical route. So it's very easy to just get labels that are bottles that are labeled. So I think if possible, it would almost be worth some sampling prior to trying to discard them as a hazardous waste. Because you've got to keep people safe, and you don't know how they're going to react if they are, particularly if they are waste chemicals where you often get contaminants in them.
Yeah.
So,
I think,
yeah, they're quite concerning.
Yeah, it is, and it's actually a practical challenge that we do have, and most of them probably are not yet even used yet.
Oh, that's not so bad then. In some way, it sounds awful. I'm sorry that they've become a waste. So stock control and procurement are key. So try not to create those unused wastes in the first place, absolutely. But if they are still as they were labelled, then I have less of then they could be transported as they are to a proper disposal facility. But I certainly wouldn't try. I do not dilute them and just get rid of them properly, please.
All right, thanks. I know we are almost towards the end of the hour, but there's this interesting questions from Eva Veno. And Eva says, what are your thoughts on the risk of creating parallel waste management interventions or disease-specific waste systems being set up for specific products? HIV, malaria, TB diagnostics, for example, especially for HIV clinics, focusing on improving the national, rather than focusing on the national health system. And I think that will also imply whether we do have systems, particularly in the pandemic now, to similarly react to the challenges that we have for waste management. It's kind of a question, comment, but I think she is trying to raise important insights.
I totally concur, and I think we have to be incredibly careful to say, okay, and now's a classic example, and I've literally need to jump off this call onto another one or two, but it's a classic example of, we've got COVID waste. I get that, but that person has also got TB or hepatitis or HIV or whatever. So we have to be very careful not to go, this is a single stream pathogen. We know that often there are a lot of coexisting conditions or coexisting pathogens in people. So we need to be very careful not to say, this is HIV specific, hepatitis, TB, malaria, whatever it is, because at that point we start to understate the other hazards that are contained within those wastes. That's think my personal opinion.
Just to add to that, when I saw the question put up, I thought it's one I want to talk about, because I think it's important to say this is exactly the whole point of the technical brief, really, and the point of the intervention package. And I'm sure Francisca will add in on this, is that we're trying to avoid duplication of effort. We're trying to avoid abortive programs being established, and we make a massive point within the technical brief that hopefully we articulated within the presentation, that we need to foster and encourage dialogue between different stakeholders to avoid duplication of effort, to avoid parallel programs being set up. So the purpose of the technical brief and identifying which stakeholders we would expect to be engaged in developing the system is to try to avoid exactly that risk of materializing.
Yeah, I'm really sorry, I'm going to have to leave, but it's been an absolute pleasure. If I can do anything else to help, please let me know. As I say, apologies, but I have to jump off onto another call.
Thank you. And I want to give Dan just 30 seconds to also round up.
Sure, no problem. Again, thank you very much for inviting us onto the today's webinar. It's been really enjoyable, and certainly the questions have been quite diverse, and certainly address the topic, and it's really good to see that there is such interest in the topic, and the number of people that are on the call is very, very encouraging. Clearly the release of the technical brief is timely. I would encourage you, if you are still interested, to have a look at the technical brief from the link in the presentation slides, and also to have a look at the capacity tool. Some of it may not be relevant to your work on a day-to-day basis, but also there might be other people and partners that you work with on a regular basis that it may help to support. So please do that. Any further questions, please feel free to get in touch with us. But I think the big takeaway for me is to try to harmonise and try to avoid the potential duplication that might occur when we have kind of smaller scale entities applying for some of this funding. Going back to that last question, and we try to encapsulate that holistic approach within the technical brief.
Thanks, Dan. And Francesca, as you round up, we do have country teams here that we are working with that have or maybe are probably in the process of applying for Global Fund grants. What does this mean as you round up here?
Yes, thank you very much. I mean, I can only reiterate, if you have specific questions, either very technical ones that I would direct to Dan and Anne, but if you have some more related to the process of how you can incorporate this intervention area into the funding request, please get in contact with me. I'm the focal person in the Global Fund for these issues, and I can also link you up with the country teams in the Global Fund that take care of the portfolios.
Thank you, Francesca, and I cannot overemphasize the fact that indeed this is an important subject, and the fact that at least there is funding allocated to this. We need to take advantage of the funding that is available, and the technical brief is timely in providing that guidance. As we have always said, action plans that we have made, they cannot be effective if they are not fundable. Here's an opportunity to do so. And my last words would be to thank all of you who decided to spend an hour with us. Thank the presenters for the wonderful presentations and also responding to the questions. And would also like to inform you that, as usual, watch out for our next announcement for the COVID-19 session series for next week. Till we meet again, good morning, good afternoon, and good evening, depending on wherever you are. Bye from me.